Thank you for joining us for this special series of This is Getting Old, sponsored by the 2020 George Washington University's University Seminar Series. Towards Age Friendly is brought to you by Melissa B., PhD, in collaboration with GW Center for Aging, Health, and Humanities. So welcome to This is Getting Old. I'm your host, Melissa Batchelor, and today we're going to be talking about age-friendly public health systems as part of our Age-Friendly Ecosystem series. In 5 previous podcasts, we've talked about the history of the Age-Friendly Health Systems Initiative and the 4 M's. And today I'm joined by Megan Wolfe, who is at the Trust for America's Health. It's a nonpartisan public health policy research and advocacy organization that envisions a nation that values health and well-being for all. So welcome to the show, Megan. And so maybe you could introduce yourself and then we'll dive into what an age-friendly health system is all about.
Oh, that sounds great. Thank you so much, Melissa, for inviting me. It's really good speaking with you today and being here as part of the podcast series. So as you said, I'm with Trust for America's Health, or TFAH, as we call the organization. And I've been with TFAH for just a short amount of time. My background is primarily in education policy and advocacy, working on behalf of teachers and school leaders, but also school health. And that's how I came to know about TFAH with their school health issues and the initiatives that they had few years ago. So I started working for TFAH in 2018, right at the beginning of the Age-Friendly Public Health Systems Initiative. But of course, like many of us, I have parents who are aging in place at home. They're 87 and 94, and I'm a caregiver as well. So a lot of my interest and passion for this work is very personal, like many of us, but really happy to be here to share a little bit more about the initiative with you.
Great. Yeah, so I think one of the things before COVID, you would say the term public health and, people's eyes might glaze over. And I think that COVID's really pushed public health, really to the front and center. So we already know the demographics, people are living longer. And so talk to me about why it was important to create an age-friendly health system. Like, why was it an important thing to do?
Absolutely. So, historically, public health did not play a large role in older adult health for a number of different reasons. One, there was no funding for it. 2, some of the Medicare and Medicaid policies didn't support a role for public health. And many people viewed the older adult health issues as really primarily the venue of the aging services sector, which does a lot of amazing work for older adults. But given public health's involvement and role in longevity and the many initiatives and interventions that have been implemented through public health over the years, it just seemed like, why not? Why isn't public health engaged in older adult health? There are many roles to be played. And as you said, with COVID, we've now seen public health jump to the forefront in dealing with older adults and really addressing some of those needs. So we wanted to just provide an opportunity to explore and expand public health's role in aging. And our goal is really that the state and local public health departments across the country become age-friendly public health systems, recognizing aging as a core public health issue, and then being able to leverage all the skills and capacity to really dive in and improve the health and well-being of older adults.
Right. And I think that one of the comments I tend to get quite often is, there's all these segments of places where you can find resources, and it makes it hard for people to connect with that. And so, pulling public health in to try to streamline that, I think is a great idea. So tell us a little bit about how the initiative got started.
Sure. So back in 2017, TFAH and the Johnny Hartford Foundation convened a group of public health, aging sector, healthcare, and academic leaders and asked 2 questions. 1, does public health have a role to play in aging? And 2, would the aging services sector welcome public health being engaged in this area? And the overwhelming consensus from everyone at this convening was yes. And so what emerged was a public health framework to support the health and well-being of older adults. So to test that framework, the Johnny Hartford Foundation funded a pilot in Florida that we started in 2018, working in partnership with the Florida Departments of Health and Elder Affairs. And we were able to solicit the engagement of 37 of Florida's 67 county health departments and their health officials, and worked with them on the ground to expand their roles in aging, really based on individual community priorities, and not going in and telling them what they had to do, but helping them to see their roles and based on the needs and priorities in their communities. And that took the form of uh, creating new data profiles for the aging population, new partnerships with community stakeholders, leading efforts to embrace age-friendly communities, and that public health role, and a lot of other policy and systems changes. So, you know, it's important to have these kinds of frameworks and begin to see the alignment. So we're really excited about the ecosystem work that we can begin to integrate public health and health systems and age-friendly communities and the other components.
Right. And I think that's one of the things that I learned, very early on in looking into what it meant to be age friendly. And it's really looking to see what are principles for any of these initiatives.
Mhm.
And then how do we take those and tailor it to where we live, and what the needs of our population are. So you got together, decided it was important. And so talk to me about, what is this framework, kind of the 5 C's of being an age friendly public health system?
Right. So this framework again emerged from that first convening, and so these are, I'll describe them just really briefly. But the 5 C's are what the Florida pilot has been all about, is really taking each of these components and seeing how their work fits within them. So the first one is connecting and convening, and the convening is a really strong Wolfe of public health. It has been for a long time. They do really well convening multi-sector groups together in coalitions. So this is about bringing together sectors and professions to strengthen the supports and services and really build up that infrastructure to promote healthy aging. The second C is coordinating the existing supports and services, because we want to make sure we're not coming in and taking over. Public health is not intended to take over what other sectors are doing, but to help really coordinate them and see where the gaps are, and increase access to services and supports. The third C is collecting data, and this is a really important role for public health. Again, as we've seen with COVID, data is so important to identify where gaps are, where interventions can be developed, and to really inform the development of those interventions, and address the needs of older adults and communities. The fourth C is communicating and disseminating best practices to support healthy aging. And the fifth C is complementing and supplementing existing support. So as I said before, we want to coordinate the existing supports, but also help to complement them. So just for an example, where a public health nutrition educator might be able to come in and bring the nutrition education into a senior center where that might not have been happening before, but that's not replacing anything that happened, but really helping to supplement what has already existed. So we have captured all of the work and all of the policy systems and environmental changes that were made in the Florida County Health Departments, and that is in our Florida summary report. And in addition to Florida, we're really excited to share that we have expanded into a number of other states. So we're working in Michigan with the Michigan Public Health Institute to develop and establish an age-friendly public health system in Michigan. And we've also recently expanded into Mississippi and Washington State, and working with the state departments of health there to expand. And it's really interesting because the states have different public health structures. So we're developing these models of how all kinds of different state public health structures can really embrace this work and expand their roles.
And I know during my health and aging policy fellowship, one of the policies that was passed was the Bold Alzheimer's Act. And it was, taking the CDC's healthy roadmap and asking public health to do exactly, to use these 5 C's to, to increase awareness and education around brain health. So, so I'm excited to see how that gets integrated into this initiative as well.
Right.
So in addition to the Florida summary report, if someone wanted to get more information about age-friendly public health systems or other resources, maybe you can just share some of those with us.
Sure. So we have a website. It's on TFAH.org, www.tifa.org, under our initiatives tab. We also have just recently worked with the Public Health Accreditation Board to help develop some recommendations for including in the public health accreditation standards and measures on healthy aging. So for all those health departments that are already FAB accredited or have to go through reaccreditation, that is going to be considered. And there's a FAB tip sheet as well on their website. And again, we can give you a link to that as well. But that provides some really quick ideas and suggestions for how to incorporate healthy aging that are based on the 5 C's, but also align with the public health measures and the 10 essential services of public health. We also have developed and are getting ready to nationally launch in a month or so an age-friendly public health system recognition program. Our recognition program is designed to incentivize state and local public health departments to become age-friendly, to take those steps and transform their health departments to be age-friendly ones. And the steps are not difficult. We intended for them to be an easy lift, but really to show the value of becoming an age-friendly public health system. And we can give you the link to that page that has all the resources that you need there. And I can be reached at mwolfe@tifa.org. So I'm happy to speak to anybody or respond to any requests. Our goal is ambitious for every public health department to be age-friendly, but there's a lot of work that can be done. There's a lot of work that's already being done, and we want to just continue to help to recognize that.
Okay. Well, thank you so much for being with me today, Megan, and talking about the Age-Friendly Public Health Systems Initiative. And this podcast is part of the Age-Friendly Ecosystem series. So please be sure to check out the Age-Friendly Health Systems podcast, along with the 4 podcasts on the 4 M's. So we have the 4 M's, the 5 C's. And stay tuned for other podcasts on age-friendly initiatives in the coming weeks. So thank you very much.
Thank you for the opportunity.
Thank you for joining us for this special series of This is Getting Old, sponsored by the 2020 George Washington University's University Seminar Series. Towards Age Friendly is brought to you by Melissa B., PhD, in collaboration with GW Center for Aging, Health and Humanities. Thank you for joining me for this week's episode of This is Getting Old, Moving Towards an Age-Friendly World. You can find more episodes like this on my YouTube channel, Melissa B., PhD, and don't forget to subscribe. You can also visit my website, melissabphd.com, and check out the podcast and blog section, because that's where I put all the hyperlinks and different things that we may talk about in any given episode. You can follow me on social media, Twitter, LinkedIn, Instagram, and Facebook. And you can also find the audio version of the podcast on iTunes, Stitcher, Spotify, and Amazon Music. So I hope this podcast gives you ideas of different things that we can do to move towards an age-friendly world, because when the world is age-friendly, it's friendly for everyone.